We are happy to welcome to the Best Docs Network in the studio. This is Dr. Ed Singleton, Podiatrist Dr. Ed Singleton, one of the best in the Dallas-Fort Worth area. Over 25 years of experience. He's your go-to guy when it deals with foot and ankle and also Tarsal Tunnel Syndrome. Explain this as far as what people may be experiencing, the symptoms with Tarsal Tunnel Syndrome.
First, thanks for having me today. Tarsal Tunnel Syndrome is a condition that's very similar to carpal tunnel syndrome in the wrist, and everybody's heard about that. It's a very similar condition that affects the nerve that goes behind the ankle and down into the foot. There's different things that cause it, but the bottom line is there's a compression on the nerve as it passes behind the ankle joint and goes down into the foot. The symptoms range anywhere from burning sensations, cold, numbness, zingers that go out the toes. People have told me it feels like fire shoots out the tips of their toes. It's sort of like hitting your funny bone.
Right.
And it affects the foot, the arch, and out to the toes.
I know a lot of people out there watching have experienced those symptoms. Now, Dr. Ed Singleton is the only one in North Texas that can treat that type of problem with a minimally invasive procedure. Explain that, doctor.
Well, I'm fortunate that I've been trained by Dr. Steve Barrett, who developed the minimal incision technique for the tarsal tunnel. Most people will approach a tarsal tunnel surgical release with an incision anywhere between 2 to 3 inches and 5 to 6 inches long, depending on how large the person is. That exposes the entire length of the nerve so that you can decompress all of the structures that squeeze on it. The approach that I use involves incision approximately 1/2 to 3/4 of an inch. That incision is placed behind the inside ankle bone, and the benefit from this is usually a much faster healing rate. Usually you're on your feet much faster, and usually you have a significant lesser amount of pain than you would with the standard open technique.
There you go. All right, Dr. Ed Singleton, providing pain freedom to your feet. Appreciate it, doctor.
Thank you so much.